In a heartfelt exploration, the speaker takes us on a journey from the world of interventional cardiology to a newfound focus on prevention and the battle against obesity. This transformation is not just a career shift, but a deeply personal evolution shaped by their own experiences and the changing landscape of medical knowledge. As we delve deeper, the speaker unveils a historical debate among scientists regarding the true culprits of heart disease. They reveal a startling narrative of how corporate interests have obscured the truth, leading to an unjust demonization of saturated fats while sugar slipped through the cracks of scrutiny. Transitioning from a broader historical context, the speaker sheds light on the often hidden side effects of statin medications. In an eye-opening revelation, a major study surfaces, showing that a staggering 62% of individuals who discontinue statin use do so due to side effects. This statistic not only raises alarms about medication adherence but also underscores the pressing need to genuinely address patient concerns. Intriguingly, John Abramson's analysis points to a shocking truth: for low-risk patients, the benefits of statins are almost negligible, with only a mere 1 in 140 chance of preventing a heart attack. This raises profound ethical questions about the practices surrounding prescriptions and the motivations behind them. As the conversation unfolds, we discover the sheer magnitude of the statin industry, with estimates suggesting that around 1 billion people globally are prescribed these medications. This reality fosters a crucial need for transparent communication about their true effectiveness, as many patients may not actually require these drugs. The discussion then shifts to familial hyperlipidemia, a genetic condition that affects cholesterol levels and impacts roughly 1 in 250 individuals. This statistic serves as a poignant reminder of the critical role genetics plays in determining one's risk of cholesterol-related heart disease. Continuing this exploration of statins, the speaker points out that while these medications are commonly prescribed for cholesterol, research further indicates that the increase in life expectancy attributed to statin use is surprisingly minimal, averaging a mere 4 days over a span of 5 years. Such findings spark critical questions about the overall effectiveness of these drugs in truly preventing heart disease. As we reflect on public health advocacy, the speaker emphasizes the vital necessity of having a robust defense against challenges posed by industries when pushing for meaningful reforms. They highlight that cultivating a rhinoceros hide, a metaphor for resilience and strength, is essential for successful advocacy. Turning the focus to a different issue, the speaker examines the pervasive conflicts of interest found within pharmaceutical research, particularly related to statins. They reveal a concerning trend where crucial data is often kept under wraps, leading to biases that can skew treatment recommendations and compromise patient care. The conversation underscores a systemic failure. Pharmaceutical companies exert unchecked power, compromising the integrity of research and ultimately jeopardizing patient safety in the name of profit. This disturbing reality demands our scrutiny. From 2003 to 2016, top drug companies found themselves embroiled in controversy, paying around $33 billion in fines for illegal marketing and data manipulation. This staggering figure reveals profound systemic issues within the industry and raises pressing questions about accountability. The speaker further illustrates a troubling trend, noting that a significant percentage of newly approved medications are merely rebranded versions of older drugs. This raises concerns about true innovation in pharmacology, as only a small fraction showcase substantial clinical benefits. As we grapple with the complexities of medicine, it becomes evident that societal beliefs often paint medicine as a precise science. This misperception only deepens the ongoing challenges within healthcare and hampers patient outcomes. Recognizing the signs of clinical depression is crucial, as symptoms like early morning awakenings, lack of energy, and feelings of hopelessness can endure for at least 2 weeks. Awareness of these signs can pave the way for timely intervention, highlighting the need for vigilance in mental health. Moreover, the speaker points out that vaccines, while essential, may carry side effects that could impact mental health, including severe reactions like psychosis. The ongoing investigation into these side effects must be taken seriously to ensure public safety. In emergencies, the importance of timely medical response cannot be overstated. Delays can have tragic consequences. Knowing when to seek immediate care can be a literal lifesaver, particularly in critical cardiac situations. While psychological stress is identified as a potential contributor to heart issues, the speaker expresses skepticism about its role in their father's condition. This nuanced perspective underscores the multifaceted nature of heart disease. An alarming trend emerges as the speaker notes a spike in heart attack risk following mRNA vaccinations. This observation suggests significant public health implications, calling for deeper investigation to understand the underlying causes. The ethical implications of mandating vaccinations for healthcare workers are critiqued by the speaker, who argues that such mandates contradict scientific evidence and the principles of individual choice. This brings forth important discussions about balancing public safety with personal rights. Drawing on experience, the speaker shares their extensive publishing history in medical journals. They focus on disseminating vital health truths that challenge mainstream narratives about vaccines, addressing controversial topics such as sugar consumption and dietary guidelines. Data from the UK government paints a concerning picture. A strikingly high number of individuals now need to be vaccinated to prevent severe hospitalization. This trend raises questions about the waning efficacy of vaccines, particularly among younger populations, and the overall benefit-risk ratio. Exploring the role of psychological factors, the speaker highlights elements such as fear and willful blindness that hinder critical thinking regarding vaccine safety. These barriers impede public understanding and acceptance of emerging evidence related to vaccine risks. The manipulation of health narratives can lead to widespread misunderstanding, significantly impacting people's choices about vaccines and treatments. This psychological tactic often exploits fears and hopes during crises, shaping the public's perception. As we examine the financial success of pharmaceutical companies during public health crises, ethical concerns arise regarding the prioritization of profit over patient safety. This troubling trend has spawned a lack of transparency about vaccine risks and benefits. The dependencies of regulatory bodies on pharmaceutical funding present a grave risk, undermining public trust in health authorities. To foster confidence, systemic changes are essential to ensure that healthcare decisions are based on unbiased information. Addressing workplace health, the speaker notes that low-paying, high-demand jobs can severely affect both mental and physical well-being, potentially leading to dire consequences. Tackling these issues is vital for enhancing overall health. Vaccine injuries have become an increasing concern, particularly among individuals already vulnerable to chronic diseases. Encouraging lifestyle changes has shown promise in improving the health of those affected, underscoring the importance of a holistic approach. Within healthcare, there exists a reluctance to acknowledge vaccine-related health issues, both among professionals and the public. This resistance complicates critical discussions about vaccine safety and patient care, hindering progress. Influential figures are highlighted as pivotal in advocating for change and elevating awareness about pressing societal issues. The speaker draws historical parallels to emphasize the magnitude of the challenges we currently face. Concerns about the motives of the pharmaceutical industry are prominently raised, especially regarding its tendency to prioritize profits over public health. This conversation reinforces the necessity for transparency and accountability in healthcare decisions. Examining the media's role in shaping public perception, the speaker critically assesses how information is disseminated. They stress the urgent need for trustworthy platforms to share the truth and combat the spread of misinformation. A recent survey unveils a startling statistic. Potentially 1 million serious adverse events related to COVID-19 vaccines have been reported in the US, raising significant public health concerns. This data demands careful consideration and thorough analysis. For healthcare and democracy to flourish, societal trust becomes paramount. However, the disconnection between public perception and medical authority poses a grave risk. Rebuilding this trust will necessitate transparency and open dialogue. An alarming increase in overall mortality rates has been noted, with many excess deaths linked to cardiovascular issues. Contributing factors, such as psychological stress and unhealthy lifestyles during the pandemic, have played a significant role in this trend. In the UK, the introduction of a sugar tax illustrates how media attention and public pressure can effectively influence health policies. This marks a notable victory against the manipulations of the food industry. Chronic stress emerges as a significant risk factor for heart disease, yet it often remains unaddressed within healthcare systems. By focusing on lifestyle modifications, we can potentially achieve better health outcomes, superseding the reliance on medication. Documentary films have proven to be powerful tools for raising awareness about health issues and promoting lifestyle changes. Their success highlights the importance of communicating the underlying truths behind public health narratives. The case of Vioxx serves as a stark reminder of the dangers posed by corporate misinformation, as it led to considerable harm while being aggressively marketed. This incident raises pressing concerns regarding the integrity of drug research. Confusion looms around vaccine-related myocarditis, with emerging data indicating that the rates associated with COVID-19 may surpass those from vaccines. This scenario underscores the pressing need for clear communication and accurate interpretation of data. Exploring the dynamics of natural immunity, the speaker suggests it may offer superior protection against COVID-19 compared to vaccines. This revelation invites critical questions regarding the necessity of vaccination post-recovery, emphasizing the importance of understanding immunity. Reflecting on the pandemic, Rogan recounts the overwhelming pressure exerted by celebrities and media to conform to specific health narratives. This intense scrutiny led him to question the authenticity of the information that was being presented. In a fascinating turn, The conversation reveals how mainstream media chose to mock Rogan's medication choice, sidestepping his rapid recovery and disregarding the validity of alternative treatments. This illustrates the challenges of navigating public narrative. Delving into the financial connections between pharmaceutical companies and politicians, the discussion raises serious concerns about the integrity of medical guidance and public health initiatives. These ties complicate the landscape of trust in healthcare leadership. Finally, the speaker highlights Robert Malone's vaccine experiences, which invite critical inquiries into the safety and efficacy of vaccines. This narrative underscores the vital importance of individual experiences in comprehending public health at large. The role of social media in disseminating health information cannot be overlooked. Dr. Malhotra's active engagement on platforms like Twitter and Instagram serves as a bridge, connecting the public with essential health discussions. As we look to the future, the upcoming documentary promises to unveil the depths of commercial corruption within healthcare while also providing viable solutions. By featuring credible voices from the medical community, it aims to enhance our collective understanding of these pressing issues.